Hi everyone, I'm really glad that you're here today. I just want to take a couple minutes and talk about something that affects us all. Whether you are on the front lines with direct patient care, or if you're behind the scenes with administration, or if you're somewhere in between, we are going to talk about why effective teams are key to the quality improvement in healthcare and how we can build stronger, more collaborative teams right here in our clinic. The purpose of this video is simple. It is to help us understand teamwork, that when it's done right, can improve our patient outcomes, make our work lives better, and then move our organization forward. I will walk you through what makes a team truly high performing and the roles that we each play, how we manage conflict and change, and the kinds of support that teams need to thrive. Let's get into it. Let's start with this. Why are we focusing on teams at all? Why not just focus on policies or individual performances? Because in healthcare, nothing happens in a vacuum. From checking a patient in, to managing their medications, to filing claims, or charting the results, quality care takes a team. And when that team doesn't communicate or when responsibilities fall through the cracks, our patient care suffers. Studies show that when a team works well together, hospitals see fewer errors, lower infection rates, and have better patient satisfaction. Teams aren't just nice to have, they are a must-have if we want safer, more efficient care. So, what sets a high-performing team apart? It's not just talent or experience, it's how the team communicates. It's having trust, clear goals, accountability, and the willingness to listen and adapt. These teams know each other's strengths, they follow through, and they talk about what's working and what isn't. In our setting, a high-performing team might include nurses who flag potential care gaps, administration who helps optimize schedules, and providers who trust and act upon that input. It's about synergy, people working better together than they could alone. Now, let's talk about roles and processes. When they're well-defined, teams flourish. But when the roles are unclear or overloaded, things fall apart. Great teams delegate smartly. They make decisions based on data, and they respect everybody's contributions, from techs to team leads. But when leadership doesn't listen, or when tasks pile up on one role, that's when quality slips. And let's be honest, lack of training, rushed onboarding, or just figure it out expectations. They hurt everyone. Ongoing education, supportive leadership, and shared decision making are what turn overwhelmed teams into empowered ones. Cross-functional teams are when clinical administration work well together. Those are powerful. They help us see the full picture. A physician might focus on a diagnosis, but a medical assistant might spot a gap in vaccinations. A billing staff member might notice patterns that affect scheduling. That mix of perspective helps solve problems faster. But let's be real. Interdisciplinary teams can also clash. People have different priorities, styles, and pressures. So how do we avoid conflict becoming a roadblock? We create psychological safety. We build respect. We keep our eyes on the same goals, and we practice active listening. When conflict happens, and it will, we treat it as a chance to improve and not just a sign of failure. Speaking of conflict, let's touch on change. It is a constant in healthcare, and it can throw teams off balance. With new technology, new protocols, staffing changes, If we aren't aligned, change creates tension and resistance. But if we involve everybody early, explain the why, and support each other through the transition, change can actually bring us closer together. It all comes down to communication and mindset. So, what helps keep teams strong over time? Culture, support, and recognition. Teams thrive when there's a culture of trust and inclusion, when the training is ongoing and not a one-time event, when feedback is encouraged and small wins are celebrated, and yes, when hard work is recognized, not just expected. Whether it's leadership coaching, access to better tools, peer-to-peer shout-outs, or wellness check-ins, it all adds up. A supported team is a resilient team. So here's the bottom line. Effective teams are the heartbeat of quality care. They are what makes the difference between getting through the day and actually improving lives. Let's commit to being a part of the solution, not just individually, but together as a team. Because when we work better together, everyone wins, especially our patients. Thank you so much for watching and being a part of our wonderful team. You have a great day.